The joint procedure I'll be discussing today is a total hip replacement using an anterior approach. The benefit to using this anterior approach versus using the posterior approach is that with the anterior approach, the risk of possible dislocation post-op is far less. The reason for this is because with the posterior approach, the surgeon will have to cut through the glute max and the short external rotators of the hip. With the anterior approach, the surgeon is going to cut between the tensor fascia lata and the tendons of the sartorius and rectus femoris muscles. Now, unfortunately, because we are coming through the anterior part, the surgeon will have to cut through the anterior fibers of the glute medius. This will need to be addressed later on through rehab in terms of making that glute medius stronger and allowing the hips to balance themselves properly. Now, the immediate concern though, post-operation that is going to be hyperextension and external rotation of the hip. Hyperextension being past that 180 point and external rotation through here. Now, luckily for us, the bulk of our everyday lives does not involve too much hyperextension or external rotation of the hip. There are a few instances where we could see some extreme examples of this. One issue off the top could be reaching for something up high and behind us. So in this case, if something's up off to my left-hand side and I had my right hip is where I had my surgery, I would be reaching up and across and behind me. So as you can see in this position, I'm in a hyperextended position. Because of that, I could run the risk of doing some damage to that joint. One other spot where we could see this is coming off of a bed. Now in this case, I'm going to use a bench as my example, but we could imagine it's a bed as well. The issue we could have is if we're someone that likes to just let our leg drop off the edge of the bed to help us get out of bed in the morning. Now, if I'm laying down, an example of that would look something like this. I'd be laying at the edge of my bed. I just let my leg drop off the side. Now, as you can see, I'm already into that hyperextended position, and I'm also seeing my legs start to externally rotate out, and then I just let gravity help pull me down and around. Now, that would be terrible for us post-op because we hit both of our major restrictions with the anterior hip replacement. One other spot we have to watch out for is sitting. When we're seated, we may get lazy and let the knees just drop out into that varus position and create excessive external rotation in the hips. Now, it may not be a problem right away, but if we went to apply force through the hip, we could have an issue. So if I went to get up and I push through my hips as such, I could have a problem with that anterior part of my hip. So, best things we can do are to make sure that as we're seated, we keep our knees pointed straight ahead. And as we go to get off, it would probably be best to use our arms to help us come up off the bench here. And I'm also going to push slightly more towards my left hand side. That way, the left hip is taking more of the weight, not my surgically repaired right hip. Now, because of the small restrictions, it could be easy to just disregard a lot of the other restrictions we see with hip replacement surgery. However, some surgeons may even say, even though it's an anterior replaced hip, they may want their patient to follow the same restrictions as a posteriorly operated hip, just to make sure we're not putting undue stress on the hip joint. That would include crossing the legs, bending over to reach and pick things up, and other things like that. So it could be a general guideline that although those usually aren't issues for the anteriorly repaired hip, we should look into following those as well as a global guideline.